All of you, welcome to Happy Gujarat channel. Today we have lecture on diabetes and its pathophysiology and its homeopathic understanding. How homeopathic doctor or predictive homeopathic treat diabetes and diabetic cases with a great ease. Today's speaker did not need any kind of introduction. We all know Dr. Amit Gohel. Gohel sir, welcome Dr. Amit Gohel sir. To cherish us about the abundant knowledge of diabetes with the case presentation. Thank you, Amit sir.
Thank you, Pradeep.
Thank you, sir.
So, good afternoon, all of you. So, today we are starting with a new journey of learning in diabetes. Practically, we homeopath came across to many cases, either of the skin, either of thyroid dysfunctions, or either of a different disease. But patient when came to us and they said that I had a comorbidities and that comorbidity is a diabetes. And we are treating just the skin disorders, we are treating just the thyroids, but we left with the diabetes. So that is what we are dealing with, understanding of the diabetes. So what we do today for the understanding of the diabetes is the understanding of the definitions, the types of the diabetes. To understand the disease in per se, we have to understand the organ as a base. So understanding of the pancreas and its functions and insulins. Then we have to understand the pathophysiology related to the types of the diabetes. Then we have to think about the certain risk factors which lead to a diabetes. Because recent era of after a COVID pandemic, we have seen a lot of cases of diabetes increasing after the pandemic of the COVID. So that is what some of the risk factors which we will deal with. Then the symptoms of the diabetes, certain complications and the diagnosis. This is called the allied part of understanding of the diabetes. And what we do in a predictive homeopathy and what we do understood the diabetes in terms of the approach of the diabetes. So for that we have to find out the cause and the conflict related to diabetes. Then the most important task of understanding diabetes is the case taking. So what are the questions we can ask to our patients to crack the cases of the diabetes? So that is what we are dealing with. And a few of the probable rubrics and a certain approach which I learned from my mentors, Dr. Suketu sir, Dr. Keir sir and Dr. Jitesh sir, as well as I learned and I read from a lot of books, so that I am just sharing my understanding and approach to this and a few of the rubrics. So it is not just a one-way directional treatment to diabetes. You need a multifaceted approach in diabetes, not the one way. As we have seen in the past that we have a PCOD, so in PCOD we have specific things that we have to prove certain things in this direction. But in diabetes it is a multifaceted, so there are multiple approach you can apply. So just I am sharing few of the notes and understanding. So how you came across the patients of the diabetes? Many a time in a clinical practice. So generally I used to came patients that the patient came with the complaint of just the skin itching, and we examined the skin itching. The middle-aged man of almost 40 years of age, 42 years of age, having complaint of the itchings on the skin, and it was a chronic itching for past 6 months. He went to a lot of skin specialists and everything, but no results. And on a sudden investigations that there is a itching which is not the eruptions on the skin, but the itching persisted, and find out that it is a diabetes. The sugar level was rising. It was 250, 230, or it was more than 300 also. So that is what we call it as a subclinical diabetes. Actually the itching is not the symptoms of the diabetes in an initial way, but it is subclinical diabetes. So after a COVID pandemic, we have seen a lot of cases that they went to investigation in terms of like insurance. I do have insurance for my family and myself. So for insurance, they just investigated and found that the HbA1c rise to 7.5, 7.8 or more than 8. So that is what we found. But we asked the patient what was the symptoms you had. The patient said that there is no symptoms at all. So this is called as a subclinical hyperglycemia or a diabetes. And many a time in an older way that the patient comes to you, middle-aged or a little bit of the 50 crosses people came to you with the complaint of the lower limb pain and having frequent urinations at the night, or sometimes they say that since few days I used to have a lot of appetite increasing and I need to have a lot of thirst. So that is what clinical symptoms of diabetes. So we came across these different kind of people in our day-to-day OPDs. So the definitions, what is the definitions? As you all know that it's a chronic disease and that occurs either when there is a pancreas does not produce enough of insulin, or insulin cannot be utilized in a proper way. That can lead to a development of the blood sugar level rises. It is hyperglycemia. So that is what definitions of diabetes. So most of the time we have to understand the role of insulin and the glucagon metabolism and the glucose metabolism. So insulin which regulate the blood glucose level, which we called hyperglycemia, that is blood sugar rising from the normal levels. So most probably the fasting blood sugar rising from the more than 140s or less than 200. So this is called rising hyperglycemia. So most common is the effect of the diabetes and over a time lead to a serious damage. So if the persistent hyperglycemia can happen in a certain patient, that can lead to damage to major blood vessels as well as minor blood vessels or micro vessels. So that can lead to certain complications. We see that in a later slide, and also it can damage to nerves and it can lead to neuropathy also. So that is what diabetes is. We all know as a homeopath that the diabetes are of three variants. That is, one is type 1 diabetes, type 2 diabetes and gestational diabetes, or nowadays this is what American Diabetic Association said, that if the hyperglycemia rises to a certain extent, they are called as a pre-diabetics or they prone to a diabetics in a later age. So that is what a different variant of pre-diabetics. So currently we have a prevalence that 1 out of 3 people are diabetics in our scenario. In India also a lot of patients rising in diabetes. So nowadays, initially in 20 years back, we see that it was later middle-aged or after that 50 that the patient may diagnose with the diabetes. But in a recent era after COVID, you must find that the person who is 25 years old or a person who is 27 years old and having a persistent hyperglycemia. So that is what the early prevalence of the diabetes, and that is the 1 out of 3 people will develop disease in their lifetime. So what is type 1 diabetes? Which we called as the IDDM, and the type 2 is called as NIDDM. The different name of the diabetes. IDDM means insulin dependent diabetes mellitus. Mostly it happens in the juvenile age. So many a time the parents came to you with the complaint that after 4, 5 years or 6 years of the age, child will not grow properly, his weight is not gaining and he becomes so tired and having weakness. So failure to thrive, weakness, and eat, in spite of eating well, the child is taking a lot of food but still the weight is not gaining. You must investigate, there must be a diabetes, and that is what you have to find out, that the juvenile diabetes. So the type 1 is called as a juvenile diabetes, or sometimes it is diagnosed in the young adult also, or the children, most commonly in the children. Why it happens? Our body, see, the theory suggested that the body immune system is not functioning properly and it is attacking the beta cell of the insulins, which lead to the destructions of the beta cells, which is producing the insulin, and that lead to persistent hyperglycemia. Because the role of insulin is to absorb the blood sugar level to the muscles level, and that is what the muscle can utilize that in a proper way. So that is what the insulin is. But insulin is not there because of destruction of beta cells. Most commonly happen after some of the viral infections. In mother, if you find that the rubella virus infections or a toxoplasma virus infections or maybe a torch positive mother, their children may develop juvenile diabetes. That is what our correlations is that the prevalence of the type 1 diabetes is the 5%. So most of time you can find out the 100 out of the 5 people for the children, they have type 1 diabetes. So most commonly the medical field is here is that it is just a preventable only, not the curable. Okay, even they say that it is not also preventable because body does not produce insulin. So they give exogenous insulin in terms of insulin injections, and that will lead to regulations of the sugar level in the body, but it cannot cure the process. So there is no primary interventions. The causes, most commonly the causes of the type 1 diabetes is the genetics. We always say that the genetics and sometimes the virus. So most of times the viral plays a very important role. There is a two virus, one is a rubella, one is a Coxsackie virus. These two viruses can lead to type 1 diabetes in early childhood. And some of the environmental factors. So all operative homeopath, as we know that we have, sir always says that there is a soil, seed and season. So if the genetic environment is there, but if the seasons can, so that is what the environmental factors is there that can provoke that and produce diabetes. So this is what type 1 diabetes. So the causes behind it is, I must say that it is a Coxsackie virus, rotaviral diarrhea. Many a time you find out the child having a diarrhea and rotaviral diarrhea that was suppressed, that lead to persistent hyperglycemia because of destructions of the beta cells. And the cytomegalo, so I must say that the children who came to you with the type 1 diabetes, you must investigate the torch test in the child as well as in the mother and parents, so that your direction of treatment based on that virus can help you to overcome the process. Again, in type 1 diabetes, there is no 100% destructions of the beta cells. There is a reservoir of the 20% of the beta cells in functioning. So it is not absolutely, we can say that everything is destructed. And autoantibodies, that is what the virus can play an important role, and our immune system can misinterpret this in the forms of that our self-antigens. So that is what self-antigens and antibody produce, and that is causing autoimmunity. So type 1 diabetes is, in our understanding as a homeopath, is autoimmune. So we need to find out the autoimmune process at the level of the child as well as at the level of mother perceptions, which can lead to autoimmunity. And the genetic factors, so most of times we can find out that the genetic disorders like HLA-DR3, HLA-DR4, which is associated with type 1 diabetes. So most of time you find out that in a family history, when you inquiring about the family history in a clinical setup, you must find out some of the autoimmunity there in the family. So that is what the genetic factor can run through into a child as a resultant. So to understand basic aspect of our diabetes and the glucose metabolism, we need to understand the pancreas. So as you all know, the pancreas is a gland, and the gland has two functions. The two functions is one of the endocrine functions and one is the exocrine function. So exocrine functions can lead to digestive phenomena and which act on the duodenum, so it produces certain digestive enzymes. And endocrine, so in endocrine there is three types of the cells which are there in the pancreas. One is called as the alpha cells, one is called as the beta cells, and third one is called as delta cells. Out of that, the share of the alpha and beta cells is high, so that we have to understand the alpha cells secrete a glucagon which help to increase the glucose demand whenever the needed. So it is causing the destructions of the muscles or glycolysis, so that the blood sugar level increasing in the body whenever it is needed. The insulin role is exactly the reversal of the glucagon. That is what we need to store the glucose, which is there by absorptions in the liver and which is by the blood sugar level. So if there is a threshold of the blood sugar level rises in the bloodstream, then the receptor of the insulin is stimulated and that producing the insulin, and that after that the receptor on the muscles is opening with the receptor of the insulin so that they can store the glucose in the muscle. So that is what a mechanism of the insulin. And the somatostatin, it is secreted by the delta cell. So it is also partially helping in the blood glucose metabolism. So these are the three endocrine functions. So we must need to understand these two only for the better understanding. Now, how does the insulin works? Actually, the insulin has secretions from the beta cells, which is secreted because the threshold level of the blood glucose is high. So the feedback system to the brain, which is stimulating the pancreas, that you must secrete the insulins, and the insulin secretions happen. So what happens? Insulin does not act directly. They need something. So for that they have to love with some receptors. This is what I have made easy to understand. So the insulin receptor, this is husband, this is wife. You have to remember this. If they are in a good relationship, then it is working in a proper way, that glucose can be utilized in a proper way and it enter into the cell. So when this is working in a proper way, so binding of insulin to the GLUT4 from the GLUT4 storage vesicles, which is called as GSV, okay, glucose storage vesicles, to the plasma membrane. So all the glucose, so if it is there, because it is acting on this, so it bind to GSV and GSV open the GLUT4 gate. So GLUT4 is what the glucose can enter into the cell, otherwise glucose cannot enter. So that is what, if it is there, then it can open, but it directly not act. So it act on this, it act on this, and then this act to open this. So this is what the working of. So glucose can enter into the cell and glucose can store. So that is what the muscles or the cells can utilize glucose in a proper way. If this is not working, suppose, and the persistent hyperglycemia is there, what is the cell feeling? Cell feels that I do not have the energy, I want that energy, and that is what they are starving. Okay, so we will see in later on the conflict is there. So why I am giving you the understanding of the pathophysiology, because this pathophysiology, please, this pathophysiology which help you to understand the conflict also, and that is why I am just proving that this is very important. So I just say that husband and wife relationship, if relationship is disturbed, what will happen? This is not working. So we'll see in the later slide. So what happens in type 1 diabetes? Generally, normally our pancreas is working. Pancreas has beta cells which produce insulins, and insulins will help to act in the same way which we see in this way. So the glucose can be utilized properly and metabolized into the cells, so that our blood sugar level threshold has reduced to normal level. So that is what the normal mechanism. But what happens in type 1 diabetes, that our immune system, like a T cells, which destroyed by the autoimmunity, leading to destructions of these beta cells. See, green color was the T cells and the yellow color is the beta cells. So beta cell destruction is going on, and that is why the insulin is not releasing. So here one thing is insulin is not there. So in a previous slide, what if this was not there, then this cannot be happen. This is something. If this is there, then also something is happen, then can be different pathophysiology. So we can see that the insulin is not utilized or insulin is not produced because of beta cell destructions, which can lead to the persistent hyperglycemia. It is the pathophysiology of type 1 diabetes. Any query regarding type 1 diabetes up till now, up to pathophysiology and basic understanding of pancreas? Okay, hope everything will be clear because I have made this in a chart so that it is easy to understand. Now we shift to our different type of diabetes. It is called as the type 2 diabetes. So we must encounter type 1 diabetes. We have seen that it is a 5% cases are the type 1 diabetes. But this is very important. So most of the diabetic persons, 90% of the cases are type 2 diabetes, and in ratio is very high. Okay, nowadays 1 out of 3 people you find that there is a persistent hyperglycemia. Okay, so that is what type 2 diabetes. Why type 2? Type 2 diabetes used to be called the adult onset. So different name was given, that MODY, maturity onset diabetes of the young, MODY. Okay, so non-insulin dependent diabetes, as I said that was insulin dependent. Now what happened here? Body can produce insulin, but it cannot utilize properly. So you have something, but you cannot utilize in a proper way. Then also it can produce the diabetes. Okay. So glucose doesn't move into cell. We know the pathophysiology. They pile up into the bloodstream. So bloodstream threshold was increasing, and that lead to development. So symptoms when they do occur are often ignored because they may not seem serious. So now what happened? One mechanism is not working. Okay, that is what insulin is there, but it cannot be utilized. Now what happened? Body glucose level, blood glucose level was rising into bloodstream. Then another mechanism has been started. The kidney started functioning, that I need to throw out the excess of glucose, and what we find the symptoms is glycosuria. Are you getting me? This is glycosuria is nothing but the body's mechanism to lower the glucose level. Okay, and many a time we find that the doctor gives the anti-glycosuric remedy. Allopathic doctors, they give that, but it can help, but sometimes it can disrupt to the higher level. So this is what you have to understand. And body cannot utilize, so, and it can develop at any age. So many a time we found out after that the recent pandemic, COVID pandemic, can lead to this. Most commonly, one of the triggering factors which we have seen, that the vaccinations. See, vaccination does not affect every people, but those people who are susceptible to vaccinations, that can trigger to the autoimmunity, and that lead to a diabetes development. So that is what something we can think of. Okay. Now, as you all know that, so what is that? In diabetes type 2, the metabolic disorders arising from insulin resistance and impaired insulin secretions. Okay, leading to the high blood glucose. Now what happens? Two pathologies are there. So here the pancreas is producing less number of insulin. Okay, then also insulin secretions is reduced and it cannot be utilized to persistent hyperglycemia. And previously the insulin is not utilized properly by the receptor because the relationship between the receptors and insulin has been changed. So first happen this, then this, and then this is what we have. So we have two things: insulin resistance, insulin secretions. So that is what. Now this is also helping us to understand the conflict in terms of. Okay. So glucose is persistent. So now pathophysiology, very important. This slide is very important to understand the pathophysiology with miasmatic perspective. So first and foremost thing, what happened? The insulin receptor on the cell surface become resistant to insulin. This is what, how resistance we have to find out the element in cause. Okay. So first process starting with the insulin resistance. So resistance means I have to work. work, because if anything resistance, I have to work fast, I have to work more. Okay, so body try to, so this is what ailment, and then body try to project. So this is a sauropsychotic process is going on here. Then what happened? The signal going to the brain, and the process is that there is no insulin. We need more insulin because the resistance is there in the cell and hyperglycemia is persistent. So signal goes to the brain that we need more insulin. So the feedback mechanism from the brain to the pancreas that you must increase more insulin. So pancreas start and secretion more insulin. This is called hyperpsychosis. Okay, hyperpsychosis. Now body try to compensate, increase. Now what happened? At one time the beta cells of the pancreas got tired because of overuse and over excess of functioning and working. So that what happened? The beta cells change, and then the secretion has reducing. This is called this is called as more use atrophy, not disuse. Excess use can lead to distractions. Okay, so here the insulin is reducing. Okay, this is called as hyperpsychosis, this is called as hypopsychosis. And till that it is not happening, then what happens? Body is not managing, it can go to destructions of, so this is called psychosyphilitic. So sauropsychotic, psychosis excess, psychosyphilitic. Depending upon, you have to do the C-peptide and you have to do the serum insulin level, and on the basis of that you need to find out that which miasm he is. So the mechanism is like that. If the insulin resistance is there or inadequate insulin is there, secretion lead to type 2 diabetes. So this is what one is, resistance also increase the glucose level, and the less secretions of the insulin also increase the glucose level. This is what the type 2 diabetes. So in type 2 you need to find out 3 variants: sauropsychotic, psychosis excess, and psychosyphilitic. Are you getting me? This is what we have to understand. So according to that, your cause has to be probed. Here ailment is most important, here the disposition is most important, here the perception is most important. Are you getting me? And in autoimmune cases, you need to find out the perceptions of autoimmunity at the level of mother as well as the child dispositions of autoimmunity. You need to probe it. That is what we have to call as a base. If there is no base, then autoimmunity cannot be risen up. Okay, so that is what you have to think in this pathophysiology. Now at the same time, what is the liver effect? Yes sir. So the insulin is there, but insulin is not working. What signal goes to liver? So liver, what is the function of the liver? Every food we eat, the liver start to absorb it. Liver start to absorb from the intestine, and from intestine to liver, and then liver try to manage everything to store the glucose to certain extent. So they send the glucose level to the blood, and then the blood has to store into the muscle. Now muscle tells the liver, what is that? I didn't get the sugar. You sent me, but I didn't get. Liver understand that I stimulate the pancreas also, give insulin so that it is working. But the same way, what happened? Liver started 2 processes. One is called as gluconeogenesis and one is called as glycogenolysis. These are the 2 different processes. Gluconeogenesis, that means the new glucose has been developing, and glycogenolysis, that means the destructions of the glucose from the fat as well as the protein. That is what the glucose is increasing. So in combination of this process, what is the liver feels? I do not get enough. Are you getting me? I am sending you. Muscle said I do not get. Pancreas says I am sending you insulin also. Liver says I do not get it. So the combinations of the insulin resistance on the liver cells and the inadequate insulin secretion by the pancreas make the liver think glucose are low when they are actually high. Are you getting me? This is what high. In the blood level it is high, but liver thinks it is low. What was the rubric we can think of? Fear of poverty, although we are prosperous. Are you getting me? Okay, so from that you can directly reach to the remedy. So the liver increase gluconeogenesis and glycogenolysis, which raises blood glucose level even more. So in spite of giving medicine also, sugar cannot come down. In spite of giving medicine, sugar cannot come down. Patient was on OHA, oral hypoglycemic agents, but still દવા સાહેબ ચાલુ છે, બે ગોળી ચાલુ કરી, ત્રણ ગોળી ચાલુ, હજી 300 ડાયાબિટીસ હોય છે because of this process. Are you getting? So we need to remove the perceptions of the liver so that the glucose level has to be down. So there are few rubrics we have to think of in this process. So we need to find out here the perceptions. So in spite of persistent hyperglycemia, OHA is given, but still the patient is on not reducing glucose level. 3 months back you had done the HbA1c, it was 8.8. 6 months back it was 9. After your medicines and OHA, again 8.8. No change at all. Persistent 250, 300 is there because liver is at fault. So liver think I do not get enough. Okay. So this is what a few pathophysiology.
As far as weight loss goes,
Yes.
and
They-
liver
there
liver
is
sacrifice their fats and
Yes.
proteins. First
Yes.
fats, then proteins.
Yes. In making of this process, gluconeogenesis is prepared from the fat cells. So the fat cells started reducing. So patient says that in spite of having hyperglycemia and everything, I loses my weight. And also the gluconeogenesis, that means the reverse process from the muscles has been started. So muscles is also starving and muscles also destructing. So that is what glucogenolysis. And the liver accept glucose from the muscles and the fat, and then it lead to the bloodstream. So bloodstream can maintain. So that is what the process. So here few remedies are there. Okay. So pathophysiology is very important to understand. The third type, which we called as the requirement is high, and to overcome that requirement, the diabetes is persistent in the female. So there are few remedies there in the repertory. We have that diabetes during pregnancy. Only 2-3 remedies are there. You must try it because it is a physiological and it is a requirement. Okay, but after that the physiology has been maintained. You need to remove the perception of the mother also, so that it can again restore. Otherwise it can go to the higher. So what was the things? So most of time you find out that first pregnancy I got high sugar level, in second pregnancy I got high sugar level. Sometimes you find the history of the abortions, so you can find directly prove that there must be some viral infections, either a torch, rubella or cytomegalo. Or having a what was the effect of that? So the effect of this diabetes is the rising of the baby weight. So baby weight is more than 4.5 kg. So it is what written in more than 9 pounds. And the ratio of this diabetes is 18 out of 100 women who are pregnant having gestational diabetes. Again, one of the risk factor is the late age conceptions can lead to diabetes in the female during pregnancy. So gestational diabetes. So these factors, we have seen the risk factors is the genetics, that is what we call as the seed, then the family history, again the seed, then the PCOD. One of the important role is the comorbidity of the persistent hyperglycemia with the PCOD. So nowadays the gynec doctors will advise whenever the patient encounter with the irregularity of menses, the gynec doctor advise serum insulin level, and they also promote that weight gain is there, so they give a metformin for the treatment of PCOD. Okay, it is a type of OHA. So PCOD is one of the risk factor that can lead to the diabetes in the female. Races, this is what our understanding. African American is everywhere, it is there. Asians are more prone to diabetes. Okay, the book says that the age 45, but it is not actually the book says, but nowadays you can encounter a 24-year boy having diabetes. And environmental factor, that is what the lifestyle inactivities, and the weight gain can lead to the risk factor. So we have our symptoms. We all know that the symptoms of the diabetes is a frequent urination. This was the first symptoms that developed after the persistent hyperglycemia. Because body is trying to throw out the excess of glucose to overworking of the kidney. So frequent urinations, if the frequent urination is happening, what the hypothalamus feels that I must have the dryness in the body. So that dryness lead to what we call as increased thirst. So the subsequent symptoms is the increased thirst. Then feeling hungry. Why? Because liver feels that I do not have a proper glucose, so I need a more glucose. So that is feeling hungry. And after that, if it is goes to the microvessels of the eyes, it can lead to the blood vision. If it is in the skin, the excess of glucose lead to the slow wound healing. So in wound healing, the glucose level has to be maintained. So in the peripheral circulation, if glucose level is high, it can enhance the bacteremic activity, and it can lead to the sepsis and septicemia, so that wound cannot heal easily. In spite of having hyperglycemia, more thirst, more water and more food, but the patient is not utilizing in a proper way, they develop a tiredness and the weakness, and there is unexplained weight loss. It is the last syphilitic version of our diabetes. So many a time you came across the patient that since 4-5 months I lose 20 kg weight, and I found the report, and report shows that some બધા report કરાય cancer સુધીના બધા report કરાય ને, but I found that it is a persistent hyperglycemia that lead to weight loss. So that is what genolysis. Okay, so these are the few symptoms as same. In a female we can find out that vaginal infection. So the female came to you with the complaint of candidal vaginitis. Recurrent candidal vaginitis, the female complains that there is a leukorrhea, there is a itching, there is a burning, and that in spite of giving a candidal treatment, anti-candidal, antifungal treatment, the patient cannot recover. Then and then you must investigate the female that there must be an increased blood sugar level. Okay. If it is acting on the nervous system, it can produce a numbness. It is a kind of a neuropathy. Then if it is acting on the microblood vessels of the male or female sexual organs, it can lead to the dysfunctional erectile dysfunctions. So that is a sexual problem and everything. That is what we have. So always tired, wound, weight loss, and everything the same. So what are the complications? If the persistent, please, if the complications, if the persistent hyperglycemia is there, what could be it can cause? So we know that it directly acts on the kidney. Why kidney? Because kidney is trying to throw out the more sugar. So the microvessels of the kidney got affected, that lead to the nephropathy. Persistent hyperglycemia, our functions of the brain to utilize the more glucose for the brain, so that the brain can eat only two things. One is a glucose and second one is oxygen. So that is what the more glucose can lead to the damage of the peripheral nerves. So peripheral nerve, it can lead to a microvascular aneurysms, can lead to a stroke, and also it can affect the major blood vessels of the coronary. It can lead to the heart attack, peripheral artery disease. It affects the eye. In the eye, it can produce the blurry visions and retina and produce the retinitis. Initial stage followed by it can lead to a retinopathy. Then glaucoma and cataract. And if it is acting on the peripheral part, so there must be some persistent infection leading to ulcerations and destruction of the part, which we call as diabetic foot or diabetic gangrene. These are the few complications. So as you all know that we have a microvascular and a macrovascular complication. So in macrovascular can cause plaque formations in the vessels leading to cardiovascular disease, heart attack and stroke, and the peripheral vascular disease, which we call as DVT, deep vein thrombosis. Okay, but in microvascular it can lead to the damage to the small blood vessels, Yes. Sugar can deposit it into plaques. Read atherosclerosis, and in atherosclerosis the plaque can store the sugar. Yes. Yes. Yes, exactly. That is the mechanism. So in macrovascular it can produce a plaque. In a microvascular it damage directly to the blood vessels, destruction leading to diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy. How can we diagnose the diabetes? So our tool for diagnosis of the diabetes is we need to investigate the blood sugar level. So many a time the patient comes to you directly with the report, so you have a diagnosed case, and if you do not have a diagnosed case, you need to diagnose with this fasting PP, HbA1c, HOMA-IR is insulin resistance test, C-peptide it's an enzyme, serum fructosamine which gives a short-term hyperglycemia. Okay, and serum insulin. Why this test is important? If the person having a comorbid blood disorders, say for example anemia. So in anemia, when you do for HbA1c, HbA1c shows low, but person having a high glucose level. So in that case, you need to investigate serum fructosamine, which will help you to diagnose that your direction is right or wrong. So these are the two investigations. The parameters of this is diagnosed given by the ADA, American Diabetic Association. Normal is less than 5.7, HbA1c, fasting less than 100, random blood sugar not applicable, but it is less than 200. 5.7 to 6.4 is a pre-diabetic as per ADA, 100 to 125 and not applicable. If more than 6.5 HbA1c, so the better target to control that is up to 6 to 6.5. So if it is a diabetic and we can back here, then it is the curative way of diabetes in this process. But it has to be managed persistently, and more than 125 FBS, and the ppbs is more than 200. So up till now this is what the allied part we have covered. Now we need to understand the cause and conflict. So according to you, what can be the cause and conflict? Up to this pathophysiological understanding, what can be the probable cause and conflict? As we learn the German new medicines, from that we can understood that there must be two conflict associated with the diabetes. One is called as a fear disgust conflict, and one is called the resistance conflict. Okay, what I practically perceived, it is perceived as the fear disgust most commonly found in the female territory and the female, whereas the resistant conflict most commonly found in the male, as per understanding of GNM. But I personally find it in my clinical practice that there must be both conflict in one person. It is not like that. Okay, so sometimes you need to probe both, and from that you can get the few of the rubric directly. So the conflict related to this, so pancreas is, I said that pancreas has two functions. One is called as the endocrine functions and one is called the exocrine functions. So exocrine functions help to digestive process. So for that digestive process the conflict are different, whereas endocrine function the conflict are different. So in digestive process the conflict is the chunk conflict, not able to utilize something, that is what the parenchyma, and the territorial anger conflict that lead to the pancreatic duct dilatation. So that is what the exocrine function. Whereas, so whenever you have a pancreatitis, you must find out this or this. Okay, sir always says that pancreas is the property. So when there is a issue regarding the property, there is a fight regarding the property, there is a conflict regarding the property, you must develop the pancreatitis, and that is what duct. So this is what the conflict here. Okay, but when you have a persistent hyperglycemia leading to diabetes, so it affects the alpha cell, which we call as a glucagon. It is a fear disgust conflict, and the beta cells, which we called insulin, it is called as resistant conflict. Now we need to understand both conflicts in detail so that we can apply, because see why I am saying that both conflicts are important, because glucagon and insulin both having a role in one person. It is not the one role as acting. Are you getting me? That is why I must find in my clinical practice that both conflicts are there in one person. So what could be the possibilities? So fear disgust conflict is something like that, the fight coupled with the disgust regarding the situations or a person. So how can it develop? How can it develop? Okay, so most commonly it is given in the GNM regarding the female. So female having revolting sexual experience, that the sexual abuse. So one of the common factor is sexual abuse, unwanted sexual practice, and the violent sex can lead to persistent hyperglycemia. I used to have one case that they came to me with the complaint of the recurrent pregnancy loss, and she had the first symptom, that is the vaginal candidiasis, irritations, and that lead to development of the process. So on inquiring this, I found that she used to have a very bad sexual experience. It is not the bad sexual experience, the experience with the husband, but husband used to do oral sex. Husband wanted that and she does not. So she have to live also in that, and she has to. So that is what the fear disgust conflict. So that is a sexual abuse, unwanted sexual practice can lead to provoke the conflict, lead to the blood glucose, and distressing involving blood, feces, urine or vomit. So this is even the sperm. I used to have a female that my husband forces me to do oral sex, and sometimes he forces me to do like a porn site what we have watched. So I just have a disgust for that thing. So that is what, again, the touch of the semen can lead to the disgust feeling. Okay, so that is what you have to probe. Many a time what Hahnemann says in aphorism number disgraceful characters वाली एक aphorism footnote आपेली છે case taking में almost in the 97-98, that you need to ask something in a private for this so that you can get the conflict. Okay, being frightened for a drunk family member. So most of time you came across this kind of husband दारू पिए છે, ઘરે આવીને બબાલ કરે, એને એક જ વસ્તુ જોઈએ. I used to have one lady, she was 68 years old, having diabetes for more than 20 years, and in that history I found that husband has only one desire, and that is sex, and every time when they are free they used to have the sex. That lady says literally કંટાળી ગઈ છું સાહેબ, I am 68 now, still he want that thing. Since 40 years of my life, what we call as 40 years of my married life, more than. So that is what something that one conflict and disgust conflict can lead to the process. Now we go to rubric later on, but this is what you have to find out in the history. Then you have to ask what was your reaction. The reaction tell you that the person is different. Okay, drunk family members, so ઘરે આવીને દારૂ પીને તોફાન કરે તો બી એને disgust થાય, and that can also lead to even the smell conflict. That means husband દારૂ પીતો તો છોડી દીધું, હવે સ્મેલ આવે છે ને તો એને તો મગજમાં એક ચાલે છે કે આ દારૂ પીએ છે. Again that conflict is triggering. So this trigger can lead to hyperglycemia. Okay, and children troubles suffer from this conflict when they have to eat the disgusting food. So many a time you find out that the children ne probe કરીને ખવડાવવામાં આવે, નાના બચ્ચાઓને બરાબર, એને ખાવું નહીં હોય, મોડું ફેરવી નાખે આ તે, please. So if this happens, then also it can lead to a fear disgust conflict and may develop a diabetes. The second conflict, very important, the resistance conflicts. So in a resistant conflict, the person wanted to oppose the situation. There is a strong opposition. Why I need to resist? Because I need to fight back, I need to stay strong, I need to be a strong. So previously you find that the child was very timid, and suddenly child becomes so positive and so strong and everything, and patient dealing with the diabetes. Are you getting me? So timidity is a weakness for that, and that is what the psychosis is developing. So this is a hyperpsychosis that can lead to others. So where the resistance is needed, most of time you need to find out where the resistance is needed in the patients. So against the person, first is the person. The resistance needed against the person, it can be parents, it can be step parents, it can be sibling, relatives, spouse, teacher, colleagues, supervisor or doctor. Okay, it can be any person. So you need to probe that what was the relationship, what was the interpersonal relation, IPR of your life, and in them where you feel it is resistance, where you feel you have that તમને કોણ નથી ગમતું, કોની સાથે અણગમો છે, ક્યાં તમને એવું લાગે છે કે તમારે ડિફેન્ડ કરવું પડે છે, તમારે તૈયાર રહેવું પડે છે. So if the person is telling like this, then you do see, very important. Father, mother died, father has second marriage, child was too early, take the responsibility, and second mother always probing. Now I have this problem. મારે દુનિયાની કોઈ વ્યક્તિ સાથે પ્રોબ્લેમ નથી, ખાલી આ એક જ વ્યક્તિ સાથે પ્રોબ્લેમ. Aversion to certain person. This is what the entry point of resistance. Are you getting me? Okay. Against any situation. So resistance has, again, first is the person, you need to find out the person. Second, against any situation. So situation can be a work, at the home, at school, or in a relationship. You can find any situations where you feel a resistance. બહુ બર્ડન છે, કામનો લોડ બહુ છે, મારી ઉપર જ બધું કામ છે, મારે કરવું જ પડે, 5 વાગ્યાનો બધા ઓફિસમાંથી 5 વાગે જતા રહે, but I have to work for the more than 6 hours or 7 o'clock. So this is what overwork can lead to. There is a resistance. Against any institutions. Suppose something happening in certain area. So for example, we generally used to have in a college the authority and the student. Okay, so there is always a conflict between authority and student. So in some process, some student has to fight against that. So that can lead to this process. Okay. For example, another example I will give you, that if the person having some legal consequences, that they have some cases, legal cases, and they have to appear into the court, then also they feel the resistance. That can lead to development of a diabetes. So that is what you have to probe any issue. So out of this you have to find out the situation, his need and his reactions. Very important. Later on we can give you idea. Against decision made over one's head or being forced to do something against one's will. Here we call it antagonism. Or sometimes we have to, our order, we have to take the order. Otherwise we cannot survive. બોસ કે એમ કરવું પડે, અગર ના કરીએ ને તો પછી કાઢી મૂકે, તો કાઢી ના મૂકે. Mostly it happen in diamond workers in our recent time. The diamond workers has to work full time. Diamond work to work as the boss said, and if it is not working in that proper term, diamond work have to throw out. So that is what the against is wish. Here the sensitivity is what injustice cannot support. So in resistance you need to find out that injustice cannot support. Okay. Children suffer from the conflict at early age when they resist to daycare, kindergarten, school, or strongly oppose. So what kind of personality is? Whenever there is a resistance and the person is having a what we called as resistance against something, but I need to stay there. So first is sensitivity, injustice cannot support. What my disposition become? I am a defiant, I am a rebellious, I am an anarchist. Are you getting me? Or sometimes I have to accept that even though injustice, I have to accept that and work against that. That is antagonism. Or I have to accept that and I have to adapt to that confusion of identity also. So that is what you need to find out the disposition from here. Are you getting me? So now it is very important to understand how both conflict helping in fasting and PPBS. This what I learned from our SCPH batchmate, Dr. Sanjay Pal from Mumbai, who had shared this slide with me and who taught me something that from where we have to enter into the case of diabetes and understanding. Now we have a diagnosis is based on the reports only. Okay, our judgment is also based on the report only. We have to do fasting and PPBS. We don't do every time HbA1c after 15 days of follow-up. We just need to do FBS and PPBS. Now understanding the fasting and understanding the PPBS. Now what is the fasting? Fasting means more than 12 hours of the sugar bloodstream into the blood when the food is not available. Are you getting me? Food is not available. So if food is not available, I need to survive for a longer time. I need to maintain the sugar for a longer time. That is called fasting. Okay? And what is PP? PP postprandial is I have a food and then my sugar is rising. So that is the PP. Okay? What is these things? Here in fasting is the futuristic process. Futuristic process means tomorrow what will happen? Something will happen tomorrow. Okay? Some big thing will happen tomorrow. So here the constitutions who are very very anxious and anticipatory constitution comes into this. Okay? Whereas in a PP the persons need more energy after food. That means I have to work fast, I have to run fast, I have to go fast. So that I need more energy after food. So that is what the thing. So on the basis of that, what is that? Something which is disgusting about life, which can lead to futuristic tensions. Are you getting me? That's why the fasting is increasing. So my mind is working more and more. In our SCPH class, Vijayakar sir has told that when our mind is working more, then sir take the rubric prostration of mind, because mind is overworked and tired. Okay? So here in fasting there is a prostration of the mind. Why? It happened because of disgust of with the life. Some situation is happening in the life and here constantly. So the person is living in the past, present and the future. Some past experience lead the persons to think more about the future. That can lead to fasting increase. Are you getting me? Easy? Now PP. What is the PP? Postprandial means wanting more energy to work and the power. So if I need to achieve something, suppose I need to achieve something in my business, I need to achieve something in my work, I need to achieve in my corporate, or I need to achieve in career, what to do? I need more power and more energy. What is this? Body try to increase the glucose. So in fasting, what if you have a fasting more than 250 and PP is 180? What could be your question? Are you getting me? Are you getting me? You have a different version of the patient, but you have to probe in this direction only, so that you can have. Sometimes you find that fasting was 100 and PP was 300. Fasting was 100, PP was 300. So patient having no futuristic anxiety. Okay, no bitterness, but patient having more work task oriented. So that is your task. So this is what you have to. So you need to probe this. Where you feel looseness in the losing sweetness in your life. So patient says disappointment in love. હવે ભવિષ્યમાં એવું થાય કે બે વાર સાહેબ છે ને સંબંધ તૂટી ગયો. એકવાર સારું હતું, ગોઠવું બધું બરાબર, ફેમિલી સામેવાળાએ ના પાડી. બીજી વાર પ્રોબ્લેમ થયો પાછું. હવે સંબંધ કરવાનો છે, છોકરી હા પાડતી નથી. What is this? Fasting is rising. Relationship does not work properly. Okay? Losing sweetness in life. Having no enthusiasm or zeal in the life. તમને ક્યારે એવું લાગ્યું કે તમારા જીવનની મજા જતી રહી? આસ્ક ધ ક્વેશ્ચન. ડાયરેક્ટ ક્વેશ્ચન નહીં પૂછવાનું કેમ ડાયાબિટીસ આવ્યું, શું થયું, ક્યારે થયું, કશું જ નહીં. તમારી લાઈફમાં તમને ક્યારે એવું લાગ્યું તમારા જીવનમાં જે મજા હતી ને પહેલા બાળપણ જેવી એ ક્યારે જતી રહી? This patient will tell you story. Okay? Bitterness in relationship. Okay? What was the bitterness in relationship? પહેલા મેરેજ થયા ત્યાં સંબંધ થયો, છોકરાએ ફોન પર વાત કરવાની, અમારા સમાજમાં ના પડે ફોન પર વાત નહીં કરવાની, પણ તો અમે વાત કરતા હતા. પછી રાતે 2 વાગ્યા સુધી ફોન કરે, હેરાન કરે, પછી કંટાળી ગયા, 6 મહિના સંબંધ રાખ્યો, પછી છોડી દીધું. પછી બીજે નક્કી કર્યા, ત્યાં લગ્ન થઈ ગયા. લગ્ન થઈ ગયા પછી પ્રોબ્લેમ શું છે? પેલો એવો હતો ના એવો નીકળ્યો. bitterness. What is that? Embittered feeling. Embittered feeling. Okay? So that is what bitterness in relations with loved one, stress about loved one. Okay? That can also lead to. Now the second point is PP. What is PP? Ye dil mange more. I need a more power, more energy. So here the insecurity about the future. So too much workload. Now very important. Hurdles, obstacles in the work. Very important. Patient will tell you. One of the rubric which help you, a case of lack equine. The hindered. Yes, hindered. So I have to work, focus, લક્ષ હોય, ફોકસ હોય, મારે કામ કરવાનું હોય, એક જ વસ્તુ કરવાની હોય, દોડવાનું હોય, ભાગવાનું હોય, બટ આપણે જે કામ કરીએ ને એમાં કોઈક રોડા નાખે, કામ ન થવા દે, અહીંથી નડે, આ અટકાવે, અહીંયા પ્રોબ્લેમ થાય, ગવર્મેન્ટમાં જાય તો ગવર્મેન્ટમાં પૈસા આપવા પડે, ન્યા અટકે આપણું કામ, આપણા કામ પૂરા થાય જ નહીં, મારે પહોંચવું છે, મારું લક્ષ્ય નક્કી છે. This was the case of lack equine. Hurdle, obstacles in the work. So perception is delusion hindered. Okay? Delusion, obstacle. Delusion partly by the aurum is there. Okay? Obstacle partly by himself and partly by the faith. The aurum is one of the remedy. Okay? So these are the few remedy which help you to understand, overcome this, because they are work oriented. Aurum is duty bound, work oriented. Okay? Third, where you get the power and energy, you get the power and energy from the money and the finance. So if the finance related some stress can lead to the increased PP. There is where you get the power from the esteem and positions. So if there is a conflict related to the positions and esteem, okay, સમાજમાં બહુ મોટું નામ છે અને સડનલી એના જ ફેમિલીમાં કોઈ એવું કંઈક કામ કર્યું અને એનું નામ which we called as position loss of, okay, that can lead to diabetes. ત્યારથી ડાયાબિટીસ આવ્યું છે. શું કે સમાજમાં છોકરીઓને લગ્ન કરાવી દેવાના, બહુ મોટું કામ કરવાનું, સેવાભાવી માણસ, બરાબર છે, બહુ બધી છોકરીઓના એને સમૂહ લગ્ન કરાવ્યા. હવે એની છોકરી કોઈ છોકરા હારે ભાગીને લગ્ન કરે તો એ માણસની હાલત શું થાય અને ડાયાબિટીસ આવે તો આ પોઝિશન. Okay, ailment from social positions, honor wounded, or sometimes which we called as disgrace. Disgrace was in the grace of the society ma, a grace is 0. Disgrace was 0. Okay, the remedy can be steffi, remedy can be sulfur, remedy can be platina also. So that is what you have to esteem in position remedy. You can directly enter the social position concern of. Okay. Now designations or stress related to the progress. Corporate world માં કામ કરે છે, બરાબર છે, અસિસ્ટન્ટ મેનેજર, PM, GM, પછી સ્ટેપ બાય સ્ટેપ CEO સુધી પહોંચવું છે અને એનો સ્ટ્રેસ છે. ઓકે, તો ફોકસ છે, બટ there is a process. Corporate world, Reliance, Tata, કઈ પણ જગ્યાએ. Okay, property related. Most of time the conflict related to pancreas is related to property. That means the hierarchical or what was an ancestral property conflict ચાલતા હોય. જમીન હતી, બરાબર છે, 100 વીઘા જમીન હતી, હવે અમારા ભાગમાં 1 વીઘો નથી થયો. That was the conflict. So એ conflict અથવા એક્સપાન્શન કરવાનું છે, બિઝનેસ કરવાનો છે અને એમાં કઈ કોન્ફ્લિક્ટ ડેવલપ થયો, અથવા પાર્ટનરશિપમાં બિઝનેસ કર્યો છે અને પૈસા હલવાઈ ગયા છે તો કઈ કોન્ફ્લિક્ટ થયો, So that can lead to this process. Okay, પ્રોપર્ટી છે પણ એમ લાગે છે કે આપણા હાથમાં હોવાની નથી. જ્યાં સુધી કોઈ બા સાઈન નહીં કરે ને ત્યાં સુધી આપણી પાસે પ્રોપર્ટી આવશે નહીં. હવે કોઈ બગડી ગયા, હવે શું કરવું? હવે એના છોકરા ના પડે તો સાઈન નહીં કરે. So that was the conflict related to this. So this is what PP is increased. So you need to probe at certain level. Now case taking part. હતું understanding part of conflict. કે conflict માં આપણે શું જોવાનું, આટલા conflict હોઈ શકે. case taking માં શું પૂછવાનું? અહીંથી આપણું case taking ચાલુ થશે. Okay, so first we understood the disease per se, then we understood the mental cause of FBS and PPBS and conflict. Then we need to ask certain questions. Okay, so કેવી રીતે? Question to be asked in the diabetes to solve the case. First question, શું પૂછવાનું? Exact durations and years since when he or she developed DM. ક્યારથી ડાયાબિટીસ છે? સાહેબ મોતિયાનું ઓપરેશન કરાવવા ગયા ને રિપોર્ટ કરાવે તો ખબર પડી ડાયાબિટીસ છે. પેશન્ટ આવીને આવું કહેશે તમને. ઓકે, ક્યારે કરાયું? સાહેબ 5-6 વર્ષ થયા. અચ્છા, હવે મોતિયાનું ઓપરેશનમાં શું ચાલે છે તો વસ્તુ સમજો. કઈ આંખમાં આવ્યો મોતિયો? રાઈટ સાઈડે. વિઝન કેવું થયું? બ્લર. તો બ્લર વિઝન કેમ થયું? અને શુગર વધારે આવ્યું તો શું એવું થયું? સાહેબ ધંધામાં એવું થયું કે ભત્રીજાને પાર્ટનર, હું ને મારા ભાઈ પાર્ટનરશિપમાં ધંધો કરે. હવે ભત્રીજો મોટો થઈ ગયો એટલે ભત્રીજાને કીધું તું હવે બેહી જા આપણા ધંધામાં, ટેક્સટાઇલ. ભત્રીજો ટેક્સટાઇલમાં આવી ગયો, ધંધાનો વહીવટ મોટા ભાઈએ કીધું કે હવે એને આપી દો ને કરશે, એને સારું આવડે છે કોમ્પ્યુટરનું આનંદ. એને ચાલુ કર્યું. હવે ખબર પડી વર્ષના અંતે, 2 વર્ષના અંતે ખબર પડી કે પૈસાની કફલાઈ ચાલે છે. હવે એક તો સાહેબ આપણે ઘરનો માણસ, એનું એ જોવું પડે. વોટ ઇઝ ધેટ? 2 કોન્ફ્લિક્ટ ભેગા થઈ ગયા. એક તો મની કોન્ફ્લિક્ટ આવી ગયો, બીજો કોન્ફ્લિક્ટ શું આવ્યો? જોવું પડે. હવે નથી જોવું તો કેટરાક ડેવલપ કરી દીધો. બરાબર, પેશન્ટને ખબર ક્યાંથી પડી? કેટરાક. પેશન્ટ આપણને એવું ડાયાબિટીસ ક્યાંથી? સાહેબ આંખ બતાવો કે તો ડોક્ટરે કીધું મોતિયો છે, પાકી ગયો છે, રિપોર્ટ કરાવો ને ઓપરેશન કરી નાખે તો ખબર પડે 300 શું કરાયું. So that is what you need to probe from where it is started first. Okay, second, try to elicit ailment from which the patient has developed DM. હવે આમાં શું એલિમેન્ટ હતો? સાહેબ આપણા ને આપણા દગો કરે. તો સેન્સિટિવિટી શું હતી? બીટ્રેયલ ની સેન્સિટિવિટી હતી. બરાબર છે, તો આપણે એલિમેન્ટ ફાઇન્ડ આઉટ કરવાનું. હવે બીટ્રેયલ થી એન્ટ્રી નથી લેવાની, પણ આપણને એક એલિમેન્ટ ખબર પડી કે આની સેન્સિટિવિટી આ છે. કોઈને શું લાગે? સાહેબ ભત્રીજાને પૈસા આપ્યા હતા, હવે એવું છે કે 10 લાખ રૂપિયા આપ્યા હતા ધંધામાં, હિસાબ દિવાળીએ કરવાનો હતો, 10 લાખ માંથી 8 લાખ રૂપિયા એને ક્યાં નાખી દીધા ખબર નહીં, 2 લાખનો હિસાબ આપે છે. પ્રોબ્લેમ શું છે? ફાઇનાન્શિયલ એલિમેન્ટ ફ્રોમ ફાઇનાન્શિયલ લોસ. તો એની સેન્સિટિવિટી મની છે. આગળના સેન્સિટિવિટી શું હતી? બીટ્રેયલ હતી. તો યુ નીડ ટુ ફાઇન્ડ આઉટ ધ એલિમેન્ટ. અગર ફિઝિયોલોજીકલ લેવલે છે તો એલિમેન્ટ થી તમારું કામ થઈ જશે, પેશન્ટ બહાર નીકળી જશે. પણ ફિઝિયોલોજીકલ લેવલે નથી અને હાઇપર સાયકોસિસમાં જતું રહ્યું છે તો તમારે અહીં સેન્સિટિવિટીને ડિસ્પોઝિશન અને પરસેપ્શન લઈને એન્ટર થવું પડશે. આર યુ ગેટિંગ મી? ઓકે, તો સેકન્ડ પોઈન્ટ. થર્ડ, વિથ એલિમેન્ટ વી ગેટ ધ સેન્સિટિવિટી ઓફ પેશન્ટ. આપણને ખબર પડી એસ્ટીમ છે. જો પેલા કેસમાં એવું હતું કે ભાઈ સોસાયટીમાં નામ ખરાબ થયું કે એના માટે પૈસા ઇમ્પોર્ટન્ટ નહોતા, એના માટે એનો રિસ્પેક્ટ અને એસ્ટીમ ઇમ્પોર્ટન્ટ. તો એની સેન્સિટિવિટી આપણને ખબર પડી. બરાબર, તો સેન્સિટિવિટી થી તમને એ ખબર પડશે. ઇફ ધ ડિઝીઝ ઇઝ ઓલરેડી ક્રોનિક. હવે આ સોરિક સુધી અહીં સુધી લેવાનું. સોરો સાયકોટિક હોય તો આટલું લઈને દવા આપી દેવાની. સ્ટ્રેસ ડાયાબિટીસ. યસ, એક્ઝેક્ટલી. તો આની ઉપરથી તમારો કેસ ક્લિયર થઈ જશે. Second, if the diabetes is already existing 3 years, 4 years, 5 years, less than 1 year diabetes માં છે ને આવું જોવા મળે છે, and you can get the result within short span of time, 3 months, 4 months ની અંદર patient નું HbA1c absolutely normal, no medication is required. Okay, if the disease already chronic, try to find out the perceptions which patient has developed after ailment. Clear? Perceptions તમારે find out કરવાનું છે. Now, what are the questions? અગર તમારી પાસે ફાસ્ટિંગ વધારે લઈને આવે છે તો what should be the question to be probed? First, when did you lose the sweetness in your life? First, ડુ યુ ફીલ ડિસ્ગસ્ટ અબાઉટ ઇન યોર લાઈફ? કોઈ જગ્યાએ તમને અણગમો છે તમારા જીવનમાં? સાહેબ બહુ બધા અણગમા છે, થાકી ગયો જિંદગી છે, કંટાળી ગયો છું, આની કરતા તો વયો જાઓ ને તો સારું. તો ઓલરેડી એની અંદર ડેટ ડિઝાયરિંગ પ્રોસેસમાં જતો રહ્યો છે પેશન્ટ. બરાબર? હવે શું કામ, કેમ એવું લાગે છે તમને? એટલે પછી તમને નવી સ્ટોરી ચાલુ થાય. યુ નીડ ટુ પ્રૂવ ધેટ. ઓકે, હાઉ મચ એન્થુઝિયાઝમ ડુ યુ હેવ ઇન લાઈફ? પેલા જેવી મજા છે. પેશન્ટ આવીને છે ને તમને આ તમારે સવાલ પૂછવો નહીં પડે, સાહેબ મજા નથી આવતી. ક્યારથી મજા નથી આવતી? સાહેબ આમ થયું ત્યારથી મજા નથી આવતી. પેશન્ટ તમારે આ ક્વેશ્ચન નહીં પૂછવો પડે, બટ યુ નીડ ટુ ગો વિથ ધીસ પ્રોબ્લેમ. બરાબર? મજા નથી આવતી. ઓકે, શું મજા તમારા માટે? મજા શું કહેવાય? પહેલા કેવી મજા હતી ને હવે શું છે એ પૂછો, એટલે તમને એની અંદરથી પ્રોસેસ નીકળશે. વેરી ઇમ્પોર્ટન્ટ ઇઝ રિલેશનશિપ. યુ નીડ ટુ આસ્ક અબાઉટ ધ રિલેશનશિપ વિથ યોર લવ્ડ વન. બરાબર? અહીંયા હેટ્રેડ ફિલિંગ જ્યારે આવવા માંડે ને ત્યારે શું થાય ખબર છે? ઇન્સ્યુલિન રેઝિસ્ટન્ટ થવા માંડે. મેં કીધું ને હસબન્ડ વાઇફ, ફર્સ્ટ સ્લાઇડમાં તમને બતાવેલું. That is what insulin and insulin receptors are the husband wife. If relationship is disturbed, hatred relationship, love hate relationship is there, aversion to certain persons, aversion to sight of certain persons, misanthropy, that can lead to this insulin resistance. So relationship got bitter because of something. My husband I used to have a pregnancy, and I found during pregnancy that my husband have extramarital affairs. Bitterness started. Pregnancy में diabetes आई है. Are you getting me? Bitterness. Okay. So perceptions. Find out what you perceive. Okay. જે પહેલા જે પ્રેમ હતો એ પ્રેમ નથી રહ્યો, લોયલ્ટી નથી રહી. બરાબર? He cheats me. He betrayed me. તો તમે શું કર્યું? તમે કેમ કઈ એક્શન લીધું? તો આજ શું કરવાનું? સો એક્સેપ્ટ ધ સિચ્યુએશન્સ. આઈ કેન નોટ ડુ, બટ ધેર ઇઝ અ બિટરનેસ ઇન ધ. હવે પહેલા જેવા રિલેશન નથી. હવે અમે એક બેડરૂમમાં હોય ને તો અમારા બેના મોઢા આમ હોય. બિટરનેસ ઇઝ રેમેડી ઇઝ નેચરલ મ્યુટ. આર યુ ગેટિંગ મી? વેરી ઇમ્પોર્ટન્ટ. લવ્ડ વન. Okay? Is there anyone without whom you can't stay or miss them badly? લગન અહીંયા થઈ ગયા છે, બોયફ્રેન્ડ હજી યાદ આવે છે. બરાબર? એનો રેઝિસ્ટન્સ છે. એની હારે જે મજા કરી હતી ને સાહેબ, જે પળો એ અહીંયા નથી. What was the need? Okay? See, disgraceful characters તમને મળશે. Patient is telling this way. Okay, and you got the first visit માં ક્યારે નહીં મળે. બહુ ગોતા ખાધા 10 વર્ષની અંદર. ડાયાબિટીસ નું પેશન્ટ આવે ને ઉપર નીચે આમ તેમ બધું પૂછ્યું, કઈ નહીં આવે. But you need to probe in a proper direction, then patient will open up. Okay? PP high હોય ત્યારે કયા ક્વેશ્ચન પૂછવાના? Okay? So how much workload do you have? તમારી પાસે વર્કલોડ કેટલો વધારે છે અને તમે કઈ રીતે how you can take away? How do you take it? કેવી રીતે ઓવરકમ કરો છો? Second, is there any hurdle, obstacle or resistance in your work? Commonly આવશે. કંઈક કામ કરતા હોય તો સાસુ આવે ને ટોક ટોક કર્યા કરે, આમ કર્યા કરે, બોલ્યા કરે, આમ છે તેમ છે. હજી એનું પૂરું ન થાય તો નણંદ આવે, એનું પૂરું ન થાય તો દેર કંઈક કામ હોપે, એનું પૂરું ન થાય તો હસબન્ડ તો ઉભા જોઈએ. This is the perceptions. You need to find out. Okay? Any prolonged struggle. Okay? Mostly અત્યારે છે ને રેશિયો ચેન્જ થઈ ગયો છે, મેલ કરતા ફિમેલ માં સૌથી વધારે ડાયાબિટીસ જોવા મળે because of bitterness. Okay? Is there any money or finance related stress? How do you handle it? બહુ કોમનલી જોવા મળે. બહુ કોમનલી જોવા મળે. આ છે ને મને એક કેસ મળ્યો હતો. આઈ યુઝ ટુ હેવ અ કેસ ઓફ ડાયાબિટીસ વિથ આલ્કોહોલિઝમ. તો પેશન્ટની વાઇફ એના હસબન્ડને લઈને આવેલી કે સર ગીવ મી ધ મેડિસિન વિચ ડિસ્ટ્રોય ધ ક્રેવિંગ ફોર આલ્કોહોલ. એટલે મેં કીધું ઓકે ફાઇન. ફ્રોમ વેર ઇટ ઇઝ સ્ટાર્ટેડ 2016 ક્યારથી મોદી સાહેબે નોટ બંધ કરી ત્યારથી. ઓકે, વોટ ઇઝ ધીસ? Alcoholism after financial loss, and I prescribe remedy arsenic alb to that patient because he is very good business minded, jewelry no business, and he is a topmost businessman, but he goes into this state because of this. So that is what you need to probe, that what was the money issue. પછી તો મની ઇશ્યુ તમને બહુ બધા મળશે. ઓલાને આપ્યા હતા, બિલ્ડરમાં રોક્યા હતા, ઇન્વેસ્ટ કર્યું હતું, સટ્ટામાં નાખ્યા, 1.5 કરોડ ગયા, બરાબર? So that was the stress. Okay, so stress, how you handle it. હવે આમાં બે પ્રકારના આવે. એક કન્સેન્સસ માણસો આવે, એ એવું કહે કે ભાઈ ઘરને બધું વેચીને પાર્ટી ઉઠી ગઈ, તો ઘરને બધું વેચીને અમે ભરી દીધા. એક માણસ એવું કે ત્યાંથી લીધા, અહીંથી ઉપાડ્યા, અને અહીંથી ઉપાડ્યા, હજી ચકડા ચાલે છે પણ આપણે મેનિપ્યુલેટિવ. એટલે એક મોરલ લેક વાળો હોય અને એક કન્સેન્સસ હોય. ડિસ્પોઝિશન્સ તમને ખબર પડે અહીંથી. ઓકે, and then how do you feel if someone insult you or hurt your esteem? So most of time તમને આ પૂછવાની જરૂર નહીં પડે. You generally have the idea that this is the esteem personality and the process is going on in the esteem. Can you esteem somewhere hurt થયો છે? Okay. Second, corporate હોય તો corporate માં આ question પૂછવાનો, are you struggling for the better positions, designations or stress related to progress? કોઈ progress માટે stress છે? You need to ask that. Do you have any stress related to property, either expansion, street, losing, property already have? Okay. મારી પાસે એક પેશન્ટ છે, 5 ભાઈઓનું કુટુંબ છે, દાદા. એના 9 છોકરા. બરાબર, 5 ભાઈઓના 9 છોકરા. એમાંથી એક છોકરો બિઝનેસ કરે, એટલે બધા બિઝનેસ કરે છે, ટેક્સટાઇલમાં છે, ડાયમંડમાં છે, બધામાં છે. એક છોકરાએ 200 કરોડમાં ઉઠાવણું કર્યું. એટલે એ સમયની વાત છે, 10 વર્ષ પહેલાની વાત છે. અને એ કે જ્યાં સુધી પપ્પાની બધા ભેગા હતા, એટલે પપ્પાએ એવું કીધું કે આપણે બધાએ ભેગું કરીને જે છે ને આપી દેવાનું. અમે જેવા હતા, અમે કોઈ બહુ બધું હતું, 0 કરીને નીકળી ગયા. ત્યારથી છૂટા થઈ ગયા, અને ત્યારથી હવે સંબંધ ખરા, પણ પેલા જેવા નહીં. ધેટ વોઝ ધ રેઝિસ્ટન્સ. ઓકે, પછી રિએક્શન પૂછવાનું ડીપમાં, વોટ યુ ફીલ, બરાબર? સાહેબ હું કરીએ છીએ? રિએક્શન ઇઝ સેડનેસ after misfortune, and that was the case I had. મેં રૂબ્રિક મૂક્યા છે બે ત્રણ. ઓકે, so sadness after misfortune and loss of finance, money minded remedy, calcarea salt is the remedy. Very important. Sulfur component, calcarea components, pulsatilla are very good diabetic remedies, anti-diabetic arsenic. Yes. Do you have anxiety about anything for the futures, or what are your fears? These are the few questions to be asked. A case taking part of it. Okay, now the rubrics, our practical points starting. So understanding of the disease, understanding of the conflict and cause, how to probe the questions and case taking, and now the probing the rubric in a case of diabetes. Okay, so what could be the rubric do you have in your mind or thought process when you came across a diabetic patient? શું હોઈ શકે? એકાદ રૂબ્રિક બોલો. Fear of poverty, yes. Although prosperous, yes. Delusion poor, yes. Financial loss. Feeling want of, yes. Okay. So to understand diabetes, we need to understand little approach. So approach to diabetes. Now a different version of understanding. કોન્ફ્લિક્ટ હતો, એ કોન્ફ્લિક્ટથી આપણને હિસ્ટ્રી ખબર પડે, બરાબર? હવે હિસ્ટ્રીમાં શું ઇમ્પોર્ટન્ટ છે એ તમારે અહીંયા જોવાનું. સો મોસ્ટ કોમનલી વોટ આઈ લર્ન ફ્રોમ ડોક્ટર સુકેતુ સર એન્ડ ડોક્ટર કેયુર સર, he taught me that is diabetes is related to money and mostly the money issues. Okay, so what could be the money is more, money is less, or money is trapped, or money is to take from money someone, or either to return someone. That is the conflict. So there must be undue need of the money or undue loss of the money, projected need of the money or projected loss of the money, or futuristic need of the money or futuristic loss of the money. What is the futuristic loss of money? Invested in market. F&O. Zero. Futuristic loss. So diabetes means management, but specifically in here it is the money management. So money is the most important aspect of understanding in diabetes. So what is diabetes? Is excess of glucose. So life need glucose to exist for survival. That is called caloric need. And life need money to survive. Are anyone survive without money nowadays? No. Okay. So that money is the sora. And that is what need is more. That's why this is soro-psychotic. So mostly the soro-psychotic. So when there is a DM, try to find out the money issue. જેટલા બી કેસ કીધા એ બધામાં શું હતું? મની મની મની. હવે જ્યાં મની નહીં હોય ત્યાં બીજું હશે, તો શું હશે? We need to probe it. So try to find out the perceptions, situation and understand the perception of the patient. First, કોઈ એક સિચ્યુએશન ડેવલપ થઈ મનીને લઈને, પછી એનું પરસેપ્શન ફાઇન્ડ આઉટ કરો એટલે ખબર પડે. અગર સ્ટોરિક હશે તો એલિમેન્ટ હશે, સાયકોસિફિલિટિક હશે તો પરસેપ્શન હશે. Okay? So what he or she perceived in that situation? શું કીધું? છોકરીના આખા ગામના હું સેવા કરું, બરાબર, બીજાના મેરેજ કરો, પૈસાનો કોઈ પ્રોબ્લેમ નથી, બહુ બધા પૈસા છે, બરાબર, અને મારી છોકરીએ ભાગીને લવ મેરેજ કર્યા, સમાજમાં જે ઇજ્જત હતી ને એ ઇજ્જતના ખાકરા કરી નાખ્યા. What is this? What he perceived? પૈસા એના માટે ઇમ્પોર્ટન્ટ નથી, એના માટે એની પોઝિશન એસ્ટીમ ઇમ્પોર્ટન્ટ નથી. So that is what, so we need to understand need and sensitivity and what the perceive. Now what is their money? Money is equal to punji. So એના માટે punji શું છે? Punji can be resource, punji can be asset for survival. For my survival, my asset and my resource is different. So someone has money is the asset, someone has power is the asset, someone has love as the asset, or someone has respect or esteem as the asset. So their punji is this. Okay, their punji is this. So if the need is money, rubric kya levana? Poor na. If the need is power, rubric kya levana? Strength na. If the need is love, rubric kya levana? Despise and neglection na. If the need is esteem, respect and humiliations ક્યાં થયું છે એના રૂબ્રિક તમારે ફાઇન્ડ આઉટ કરો. સો ફર્સ્ટ એન્ડ ફોરમોસ્ટ એના માટે પૂંજી શું છે? that we need to probe it. Okay, now so first they give you cause, aid, reaction, finally rule out as per disposition. So we need to probe this only: cause, reaction, disposition. So perception is input, reaction is output. So reaction in terms of disease also, reaction in terms of his emotions also. And perception either an ailment or perception either as a delusions. Okay? So rubric. So money related rubrics, as you all know, બહુ ફાસ્ટ જઈશું આપણે થોડુંક આમાં, કેમ કે રૂબ્રિક બધાને આવડે છે. I must say, ailment from financial loss, ailment from business failure, ailment from embarrassment, poor job performance of lack equinum. Lack equinum ને છે ને પ્રોજેક્ટ સાથે કામ હોય. Lack equinum is a corporate man, people, goal oriented people. ઘોડા જેવો પાવર હોય, આર્સેનિક જેવું હોય presentations, but they have to reach to the process. And if job performance માં કઈ પ્રોબ્લેમ થયો અને એને embarrassment feel થવું, that is the lack equinum. That was the case. Ailment from loss of money to make, ailment from reputation loss. Here reputation in terms of money. Okay, Calibrom is one of the remedies. Sulfur and Calibrom, બે દવા છે. Ambition, much for money, anxiety, business about. Anxiety, money matter about. It is not just a anxiety. It is a delirious conditions, specifically in diabetes. Anxiety, money matter is not just a anxiety. It's a delirious condition because it's a matter. Matter means the big things. It is not small things. Okay, please 2 મિનિટ 5 મિનિટ શાંતિ રાખો. Awareness, generosity towards stranger, awareness regard to his family, carbohydrate, hyoscyamus, natramine, nux vomica. Nux vomica is one of the good remedy for diabetes of the youngs. Okay, right now fast achievers in this corporate world generations. Okay, boaster, braggart, which is to be considered as, it is a perception, it is not just a boasting. Okay, it's a perception, because this is the reverse perception of poor. I am poor, that's why I am showing a boastering. Okay, so that is a perception. Business aversion to business incapacity for, these are the situational conditions. Careful about business and money, desire more than she needs, psychotic. Okay, desire riches abundant means only remedies can carry out. Desire riches abundant means calcare iod. Dreams of money, पैसा ना सपना આવે. Dreams of money robbing, એના પૈસા કોઈ લઈ ગયું, ચોરી ગયું. Basilism is one of the remedy. Dreams of poverty, poor. Now again, when we take a delusion poor or poverty, this is also a very important perception, because dreams is a subconscious pattern, and that subconscious pattern can lead to the developmental process. Okay, so this is very important. Dreams, poverty, poor being. What is this? પહેલા બહુ પૈસા વાળા હતા, આપણે ડૂમ લઈ લઈએ, મિસફોર્ચ્યુન લઈ લઈએ, બરાબર? But this is also poverty, poor being. That is what the perceptions. Okay, stealing money, quarrel for the money, dispute about money, change. બરાબર? Very important. Dream, money, lending to movie actresses. બધાને પૈસા ઉધાર આપે છે. રાજા છે ને, લેક લિયો, king of the jungle. We had recently a case of Lake Leo. In last sessions of Lake Remedies, Dr. Jitesh sir shared the case of Lake Leo diabetic case. From 11.1 to 5.9 within 1 month HbA1c. So that is what the Lake Leo. Lake remedies are good remedy in diabetes. Lake Leo, Lake Equinum, Lake Defloratum with the constipation. So I will share some rubric. Extravagance for themselves, misery towards others. Calcaria. Extravagance for want of economy. Okay, extravagant by ostentation. I am showing off. Barabar? Culex. That's a mosquito. Yes, there is one rubric. Fear of extravagance, committing something, and timidity in transacting the business. The only remedy is opium. Okay, opium is very good remedy for diabetes. Fear of poverty, as you all say, although prosperous, fear of spending, yes, short of in future, nux vomica and sternum, fear of financial loss, grief from financial loss, sadness from financial loss, cares and worries full of money matter about. See, when you think cares and worries full of money matter about, calcarea ars and calcarea floor is one of the remedies. So everywhere I have mentioned certain remedy, because this remedy stands too high in diabetic cases. Groundless fear of financial ruin, calcarea floor, boric, one-liners. Now, these are the few rubrics related to money. In the first part, I said that diabetes approach is not a single approach. So you need to have a multi-dimensional, multifaceted approach to diabetes. So if you have a diabetes and some mind symptoms, enter through this also, you can get the cure in the case. If you have a conflict, money conflict, enter through that case and you can get the result. So these are the different versions that mind as a concomitant in diabetes. So what are the possible rubrics you can think of? Alcoholism, dipsomania, diabetes in. Madorinum is only remedy. Okay, the person having diabetes, person is alcoholic, this is a concomitant, mind concomitant symptoms. You can think mind, dullness, sluggishness, diabetes in. Acetic acid, halonius, nectrum sulf, opium and sulfuric acid. Now you see opium come કેટલી જગ્યાએ ક્યાં આવ્યું? Immediate in transaction business, fear of extravagant of committing something, ત્યાં બી opium હતું. અહીંયા બી ઓપિયમ છે, હજી આવશે. Sadness, depression, diabetes in opium. Okay, so fear in diabetes, this was given by Nair. Only remedy is natrum salt. Single remedy rubrics are from Nair repertoire. Okay, forgetfulness. Patient શું કહે છે સાહેબ, પહેલા મેમરી પાવર બહુ આવ્યો હતો, આ જ્યારથી ડાયાબિટીસ આવ્યો ને ત્યારથી છે ને યાદ નથી રહેતું, આટલું જ કહે પેશન્ટ. કેસ ખતમ. Patient is giving you concomitant symptom, forgetfulness, diabetes in, opium is the remedy. So this is the different version of approach. Okay, irritability, diabetes in. Sir, જ્યારથી ડાયાબિટીસ આવે મગજ ખરાબ થઈ જાય, ફેટ થઈ જાય. ફેટ means what? ચીડાઈ જાય, ગુસ્સે થઈ જાય, ફેટ થઈ જાય. That is irritability in diabetes. Sipilendra, Abroma, Helonius, Lycopus and Nux vomica. Nux vomica is one of the best remedy specifically in this case. Irritability, diabetes in, spoken to very softly unless અને બોલાવા નથી થતા જ્યારથી ડાયાબિટીસ આવ્યું છે. Lycopus. Okay, tomato. Yes. Frustration of the mind, brain pain, diabetes in, Macphos and natrum salt. So these are the different version of approach. Another rubrics, few cases. A case of the man having working in the one of the reputed diamond company, and he was given a work to bring a diamond from MP જખાણમાંથી મતલબ diamond કાઢે ને પન્ના. So he is a purchaser, he used to brought everything and then he gave. Okay, so he brought one khadan specifically in MP, and he had a contract with that person. So they never give contract to the outsiders, they have a localites. So localites use that things and even so they have a loss of almost 4 to 7 crores loss, and that person feels very sad about that thing. So after that loss, company has settled everything, still he is working the same way. Now everything was fine, company is not throwing him out of these things. Okay, company okay એવું તો થાય. Okay, but this person was having that constant phenomena in the mind. So after that event, he had many financial issue with many people. They had given many money to other persons. They came back, પાછા આપ્યા ગયા, આવી રીતે બહુ ચાલતું. And he came to me with the 11.1, 10.9 HbA1c with this history. So I asked, what was the stress about the money? So he said that incident of Panna, still something is irritating in my mind, and મને એવું લાગે કે પાછો હું પન્ના જાઉં, પાછો કંઈક 5-6 કરોડનો લોસ થયો હતો, કંપનીને કેટલું ભોગવવાનું, આમ છે તેમ છે, એનું એક કોન્સ્ટન્ટ સ્ટ્રેસ રહ્યા કરે, and he feels that I have to be watchful, careful, આમ છે તેમ છે. So that was the thing. So I just take a perceptions that delusion, imagination, persecuted one, tormented by frightful scene of mournful event of the past, and I prescribed Spongia. To my surprise, after 4 months, his HbA1c 10.9 to 7.4 within 4 months. This was a case of diamond loss. Another case, a case of a lady having a acute on chronic pancreatitis. It was a many time event in last 10 years. Many time events, and she had to admit in the hospital, Seeds hospital में admit करवी पड़े, and her lipase amylase went to more than 300-400, and that was the condition, critical conditions. So one fine day they came to me that and that pancreatitis lead to diabetes. So this is called pancreatic diabetes. Okay. So I asked about something what happened 10 years back. She said that there is a problem with the husband, and the husband having some affairs. So I found that, and we have a lot of quarrel between us and everything, and we have to separate ourselves, but we could not because property and everything is a dispute. So so we cannot separate it. So constantly that quarrel is going on for 3 years. After that 3 years, everything was settled. Husband sudri gyo, everything was fine. But still, તો અમે હવે શું થાય, હવે શું પ્રોબ્લેમ? એટલે હસબન્ડ કે સાહેબ હજી બી છે ને મગજમાંથી પેલી વાત નથી જતી. મેં તો કેમ નથી જતી, શું થાય? કે whenever I had some call from my business work અથવા અમારી કોઈ સેક્રેટરીનો ફોન આવે કે કોઈ ઓફિસથી કોઈ છોકરીનો ફોન આવે તો એને એવું જ લાગે આનું પાછું લખવું નહીં. Constantly she thinks about that and that. અને જ્યારે બી એવો ફોન આવે ને એના 3 દિવસ પછી આને પેન્ક્રેટાઇટિસ થાય અને પેટમાં દુખે ને ગુસ્સો આવે ને એને આ બધું ચાલુ થઈ જાય. What is this? This is the delirious condition of the pancreas. Okay? Again, same. Delusion tormented by the mournful event of the past. The spongia was the remedy. તો બંને કેસમાં સ્પોન્જા આપેલી. એક કેસ મેં તમને કીધું પેલો sadness after misfortune, and the remedy is calcarea sulf. Okay? Rightly said by Chirag, delusion will come to want. પ્રોજેક્ટેડ જ્યારે લોસ થાય, ફાઇનાન્શિયલ લોસ થાય ને પછી એને એમ લાગે કે હવે આપણી પાસે કાંઈ વધવાનું નથી. રેમેડીઝ કેલ્કેરિયા ફ્લોર એન્ડ સલ્ફર. ધીસ આર ધ ફ્યુ પરસેપ્શન્સ કેન પ્રોડ્યુસ અ ડિઝીઝ. સો એક મની રિલેટેડ રૂબ્રિક્સ હતા, એમાંથી તમે ફાઇન્ડ આઉટ કરી શકો. બીજું મેં તમને માઇન્ડ એઝ અ કોન્કોમિટન્ટ સમજાવ્યું. થર્ડ, રૂબ્રિક એઝ અ પરસેપ્શન સમજાવ્યું. નાઉ ફોર્થ ક્રાઇટેરિયા, ફોર્થ ફેસેટ of diabetes. Diabetes with single remedy rubrics. अगर तुमने diabetes में आउ कहीं मर गयु, just plainly prescribe, you will get the result. What is this? Mind. Alcoholism આવી ગયું, same. Fear diabetes આ mind ના rubric છે, આ બધા આવી ગયા. Okay? Eye. Retinitis. Retina. Inflammation. Diabetes in. Only remedy is Calcol. Patient ખબર પડે મોતી આવ્યો છે, ડાયાબિટીસ આવ્યું છે, એન્ડ રેટિનાઇટિસ, ઓન્લી રેમેડી ઇઝ સિકલકોર. સેકન્ડ, માઉથ, ટંગ, વાઇટ, ડાયાબિટીસ ઇન, હેલોનિયસ. ઓબ્ઝર્વેશન રૂબ્રિક, કોકોમિટલ. ટીથ, જ્યારથી ડાયાબિટીસ આવ્યું છે દાંતની બહુ ટ્રીટમેન્ટ કરાવવી પડે છે, દાંત સડી ગયા બધા. હોલો, સલ્ફ્યુરિક એસિડ. Sulfuric acid is one of the good remedy for diabetes. Hurried fast sulfur. Again બધી જગ્યાએ સલ્ફર કેમ આવે છે પણ છેલ્લે સમજાવું. You know that. Male libido, sexual desire diminish in diabetes. Cuprum met. Female menses suppressed. So PCOD with diabetes. Uranium nitricum. Clear? Easy. Okay? Respiration difficult, diabetes in, argentum nitricum. Argentum nitricum is one of the remedy for complicated diabetes. In complication there is a swelling, ankle edema with respiratory difficulties with high diabetes. Argentum is the remedy. I had the rubric, yes. Extremity swelling, ankle, diabetes in, argentum. And respiration difficult, argentum. Metabolic, yes. This is a metabolic complications. Okay. Extremity pain, rheumatic diabetes in, lactic acid. So whenever you have a combined rheumatism with diabetes, lactic acid is one of the remedies. Skin dry, hot, diabetes in, acetic acid. Skin ulcer, diabetes in, conium. And itching in diabetes. Skin itching in diabetes, આમાં બીજી બે દવા છે, agaricus and caladium in complete repertory, but in cara it is only manganese. Okay. This was the fourth component, single remedy rubric. Now diabetes with clinical rubrics. So ખાલી ક્લિનિક માં તમને ડાયાબિટીસ આવ્યું, આ છે દવા. Clear? Okay? So fourth approach is this. So diabetes alternating with uremia. બહુ બધી વાર યુરેમિયા થઈ જાય અને પાછો ડાયાબિટીસ યુરેમિયા, ડાયાબિટીસ યુરેમિયા, ડાયાબિટીસ યુરેમિયા, 3-4 વાર દાખલ થવું પડ્યું. Colchicum is the only remedy. Diabetes with amenorrhea, PCOD વધતા diabetes આવી ગયું. Uranium nitricum. Okay? Why? Uranium nitricum is the remedy for insulin resistance. So in PCOD there is insulin resistance, and also in diabetes there is insulin resistance. So uranium helps to reduce that resistance. Okay? Then diabetes with boils successive, one after another. સાહેબ ગુમડા બહુ થાય છે. આટલી બધી દવા છે. એન્થ્રાસિનમ, આર્નિકા, આર્સેનિક, ગ્રેફાઇટિસ, ઇન્સ્યુલિનમ, લેડમ, નેટ્રમ ફોસ. Natrum phos is one of the best remedy, specifically in diabetes. Okay. Diabetes with from cares and worries, phosphoric acid, psychological. From grief, phosphoric acid, psychological. Okay. Diabetic in children, juvenile. In boric, only one remedy mentioned is Crataegus. Diabetes of children. Crataegus 3 marks. Very important. So you can try this in juvenile diabetes. Okay. I do not have personally experience of this, but we will see this in future. But this is what boric has mentioned clinically. Then diabetes after death of loved ones. Husband મરી ગયા ત્યાર પછી diabetes શું છે? Calibrome. Diabetes from fear, fright after. Opium is one of the remedy. So કેટલી જગ્યાએ opium આવી? Intimidating transactions, extravagance, dullness, sadness and fright. So opium is one of the remedy for diabetes. Diabetes with gastrohepatic origins. Iris versicolor છે. એ પેલામાં આપેલું છે એ કહું. So lactic acid, nux vomica, uranium nitricum and ars iode. Diabetes with COPD. Calcarea phos is the only remedy. Diabetes with interstitial lung disease, Calcarea phos. Diabetes with chest complaint with fistula, Calcarea phos. Well, these are the concomitant clinical. So once you think of this, your remedy is this. Diabetes with prickly heat, patient ne અળાઈ બહુ થયા કરે. Cystium zambolinum is the only remedy. Okay. Diabetes in liver complaints, uranium nitricum, natrum phos and cardus myrrh. Diabetes with nervous complaints, so anxiety, palpitation, nervousness. So these are the nervous remedies. Ignatia, phosphoric acid, arsenic, aurum, calcarea. Okay. Strychnine ars was given, but it is again a nux vomica. Okay. Very important clinical symptom: diabetes with motor paralysis. Curare is the only remedy. Okay. I said diabetes during pregnancy, only 2 remedy: halonias and sacrum albo. You must try this remedy during pregnancy. They can restore wonderfully. Diabetes with stomach complaint, uranium nitricum. Sexual weakness, excess after acid phos. Diabetes hereditary. Calcarea sulf is the only remedy. So why Calcarea sulf is there in many rubrics? Because Calcarea sulf is a good remedy for diabetes. Hereditary. Carcinosin, Calcarea sulf, sacrum albo. Diabetic with rheumatic, lactic acid. Diabetes with syphilitic. આ syphilitic ને બે રીતે સમજવાની જરૂર છે. એક તો syphilitic diabetes uncontrolled. એમાં બી તમે syphilinum આપી શકો. બીજું પેશન્ટ આવીને તમને એવી કમ્પ્લેન કરે કે સાહેબ યુરિનમાં ઇન્ફેક્શન થાય છે અથવા પેનિસ પર ઇન્ફેક્શન થાય છે, બેલેનાઇટિસ હોય, તમે VDRL ટેસ્ટ કરાવો અને VDRL ટેસ્ટ પોઝિટિવ આવે અને ડાયાબિટીસ હોય, the remedy is syphilinum clinically. Okay. Fifth approach. Fourth approach clinical સમજાયું, એની આગળ મેં માઇન્ડ રૂબ્રિક સમજાવ્યા, એની આગળ concomitant સમજાવ્યા, એની આગળ. Now this was the clinical concomitant indication by Dr. Sunirmal Sarkar. Okay. So I learned from Sunirmal Sarkar sir that diabetes plus burning like sulfur, the remedy is Syphilendra indica. Diabetes plus psychotic symptoms like the thuja, the remedy is Gymnema sylvestris. Diabetes plus skin complaint, specifically diabetic foot, Cystium zambolinum. Diabetes, rheumatism, menstrual irregularity, ખાલી rheumatism હોય તો lactic acid, rheumatism plus menstrual irregularity હોય તો Abroma augusta. Diabetes with weight loss, uranium nitricum. Diabetes, neurological disorders and numbness, curare. Diabetes plus albuminuria means CKD plus rust like joint pain, rheumatism, rust aromaticus. Diabetes plus malignant hypertension plus chest constrictions, adrenaline. Shock. Diabetes plus migraine plus gastric disturbances, Chionianthus. Diabetes plus burning in the stomach, acidity, iris versicolors and pancreatinum. Vomiting, pitની vomit થાય, સવાર ઉઠીને pitની vomit થાય અને diabetes. Iris versicolor. Diabetes plus history of repeated allergy plus chili and craving for sweet. Thyroidinum is the remedy. Diabetes plus degenerative conditions of the vessels, means blood vessels, and the brain, the remedy is vanadium. These are the boring indications. Diabetes plus tired backache plus insomnia plus diversion of the mind ameliorates is helonia, female remedy. Okay. Diabetes plus impotency plus fainting, moschus. Diabetes plus impotency plus sensation as if penis absent, coca. Zero syndrome, yes.
Zero syndrome.
Diabetes plus sclerosis of brain, plumbum iode. Diabetes plus polyuria plus complaints started during pregnancy and constipations, lack defloratum. Diabetes plus joint pain plus diarrhea after getting up plus lot of flatulence, natrum sul, morning diarrhea. Okay. Diabetes, blood sugar improved during pregnancy, pregnancy ameliorate. Tuberculinum is the remedy. So these are the different version of diabetic approach. Not a single diabetic approach will work in each and every cases. So you need to probe either this way, either this way, either this way, either this way, or either this way. Everywhere you can get the rubrics and the things. So that's complete the diabetes. Thank you so much. The last questions that why sulfur and sulfur component works wonderfully in diabetic cases. What I learned and what I understood from the allopathic point of view, that in oral hypoglycemic agent OHA, they prescribe sulfonylureal compound. Sulfonylureal compound is the compound of the sulfur element. And what actually happening is, in the each and every cells of our body, sulfur is a very important role as an enzymatic activity in terms of glucose metabolism. That's why sulfur and sulfur component works wonder in diabetic cases. That is what I learned and I understood from the homeopathic perspective as well as allopathic perspective. So thank you so much. Any questions up till now? Thank you.